Hey everyone, welcome to another video. So today we're going to be talking about how to structure a second therapy session. And the reason why I picked this specific topic is that so many times we talk about what you want to do in a first therapy session, whether it's do an assessment, talk about previous treatment history, or even ask questions about family dynamics. Those are all things that we tend to think of that are covered in a first session. However, what do you do when you've gotten the first session out the way and you don't know what to do next? So, without further ado, I'll give you some ideas. So, first and foremost, it's important to remember that becoming a therapist or a clinician can definitely feel daunting. Imposter syndrome is real, and you may realize that graduate school didn't fully prepare you for all the things that you may encounter in a therapy room. Of course, education is great, and if you had a practicum or internship experience, you may have already gotten some face to face interaction with potential clients and also the community in general. But it's a little bit different when you're doing therapy on your own for the first time. So don't worry, you are in good company. So, when we talk about the second session, some of the ideas that you can do in the second session are number one, discuss relevant family dynamics by creating a genogram. You can also highlight some of the goals of therapy. Hopefully, by the first session, you've already identified some of the goals that you want to work on with the client. The second session can kind of be a continuation of those goals. You can ask clarifying questions and really help them define what it looks like to be done with the therapeutic process. It's also a good time to identify any trauma treatment needs. So with the first session, you're really focused on joining, building rapport, and building trust with the client. You may not necessarily get all the information in the first session. Many times there's initial reluctance to open up, and hopefully by the second session, you've built enough rapport so that you could ask a bit more open-ended and detailed questions about the past and identify if there's any specific trauma treatment needs that need to be integrated into the treatment plan. So, some examples of intervention ideas that you can use in session with clients for the second session are number one, doing a genogram. Genograms, even though they are in some settings really obsolete, they can still be a good way to understand family dynamics, understand the client's family of origin, and also identify generational patterns such as substance abuse, mental health diagnosis, and history that have impacted the client to the present day. Usually, genograms comprise of three different generations. So, if the client has kids or if they know anything about their grandparents, those are all great questions to ask and put on a genogram. Also, it's also sometimes a good idea to do that genogram with the client in session so they see the circles and the squares and the dotted lines and the squiggly lines, and they're able to make some of the connections themselves. You also may want to ask the miracle question. What would you do if everything in your life was perfect? What would that look like for you? And what changes will have been made, for you to be in a better place and a better headspace and to feel, more happy about your life in general. You may also want to ask them a question about what a day in their life looks like. This is a great way to assess any current stressors, assess social supports and relationship dynamics that may be impacting their daily life. For instance, somebody who works from home or somebody who commutes 2 hours a day may have a totally different experience and different stressors than somebody who, let's say, travels for work or someone who does a job that has different hours or has a different responsibilities outside of business hours. So those are some questions and some interventions that you can use to kind of fill the time in a second therapy session, but also kind of give you some initial information and can also encourage the client to dig a little bit deeper and to share more information with you. So also, if you're feeling stuck, first thing to keep in mind is that open ended questions are great. So, you don't necessarily want to ask questions that start with the word do because those questions tend to easily be answered with a yes or no. You want to stick with questions that, tend to be around like how and what. You know, how was your week? What was the best part of your day? What are you looking forward to in the future? What is the most important person you've met in your life and why? These are all questions that can give you a deeper insight into the person's into their person's background and also let you know about their motivation for continuing the therapy process. You also want to ask them what feedback they've received from family or friends. Many times people come to therapy and they have a very specific presenting problem, whether it's stress, whether it's communication, whether it's managing competing priorities. A lot of times there is a specific reason that's brought them to therapy. And when you ask them about the specific reason, you also want to know, what's going on with their social supports. Ask them what feedback they've received about this specific issue or challenge from their friends or family. Because based on their answer, you'll get an idea of what their social supports are and also the people that they go to for help and for a listening ear when they need it, which is a great way to really integrate that into your treatment plan and also use it as the basis for continued treatment and continued sessions. So we've come to the end of our video. Thank you so much for watching. Please be sure to like and subscribe. I'll catch you in the next one. Bye.